Hi, my name is Sylvia, and today I'm going to demonstrate how to do a barium enema double contrast exam. So first we're going to start off with our barium bag, and then we're going to have our air inflation cuff and our balloon inflator cushion, and our barium, 12 to 1500 milliliters. I have my KY jelly that I'm going to rub on the tip, and here's some paper towels. I have my hemostats, as well as my gloves and plenty of towels for the patient. So now that I have all my supplies, I'm going to attach the balloon inflator and test the balloon to make sure it's working. So it is. And now I'm going to attach the air inflator cuff. Okay. So next, I'm going to fill my barium bag with barium. Then I'm going to let the barium bleed out. Get rid of the air. And I'm going to make sure to hang my bag 24 inches above the table once I get my patient on the table. Then I'm also going to clamp the tube so that barium is not running all the way through, since I don't have my patient yet. Now that that's all set up, I'm just going to hang it here on the pole. Then I'm going to get my KY jelly, pour some on the paper towels. So once the patient gets here, I'll be ready to tip. Miss Diaz?
Yes,
Right this way. Hi, how are you today?
good, thank you.
My name is Sylvia. I'll be assisting with the procedure today. Can you give me your full name and date of birth?
Isabel Diaz, and February 25th, 1975.
Okay, and what brings you in today?
Well, we're having some trouble stomach, and doctor said I might have some colitis.
Okay, and is there any possible allergies to any contrast?
No.
Okay, and did you follow the prep prior to this exam?
Yes.
And when is the last meal you had?
Yesterday.
Okay, and is there any possibility of pregnancy?
No.
Okay, so here's a gown.
Okay.
I'm going to have you change into that gown, and it's going to tie in the back. And then once you come back out, we'll go ahead and take our first picture.
Okay.
And once we get started, the doctor is going to inject contrast into your colon.
Okay.
And then we're just going to take different pictures of you in different positions.
Okay.
Let me know when you're done. So now that we've taken our scalp, I have the patient in Sims position, and I'm ready to tip. So, Isabel, take a deep breath in and blow out. And as she blows out, I'm putting the tip in 1.5 inches anterior and no more than 4 inches. And I'm going to tape the tip just so that it's more comfortable for the patient. And now that it's in, I'm going to inflate it. The cuff, I'm going to give it one pump, and then I'm going to clamp it to make sure it holds. And for modesty, I'm going to place a sheet over the patient. And my bag is at 24 inches above the anus. And now I'm gonna drop the bag. And we're gonna go ahead and start our overheads. Okay, so this first overhead I'm gonna shoot is my right lateral DQ. My patient's laying on her right side, but I'm gonna use my left marker, place it on the top corner of the film, out of anatomy. Central ray is going to be at iliac crest and the mid-sagittal plane. And my SID is going to be at 40. My collimation is going to be opened up to 14 by 17. And I'm going to make sure I have light on my IR. Now I'm going to bring it back down to make sure I get the entire stomach. Okay, Miss Diaz, go ahead and take a deep breath in, blow it out, hold it out, and I'm gonna expose. The technique I'll use for this is about 90 to 100 kV and 45 to 50 mass. And now we're gonna move on to our next projection. So now we're gonna go into the next overhead, which is a PA oblique RAO position. So I'm going to rotate my patient about 35 to 45 degrees, and I'm putting in the IR 14 by 17 lengthwise. My SID is going to be 40. And central ray is at the iliac crest and 1 to 2 inches, 1 to 2 inches medial to the elevated side. Okay, so I'm going to have you roll this way. And lift your knee up a little if that's more comfortable. So I'm going to put my left marker in the light field I have down here. see, and the technique I would use would be similar, about 90 to 100 kV and 50 to 55 mass. And Miss Diaz, go ahead and take a deep breath in, blow it out, hold it out, beep. Okay, so my patient's in RAO, but the next overhead we're gonna go to PA. So lay on your stomach. Okay, and we're at 40 SID. And my central ray is going to be at the mid-sagittal plane and iliac crest. Then I have my IRN 14/17 lengthwise. And then I'm going to put my left marker on my patient's left side. Okay. And the technique I would use for this projection would be 90 to 100 kV and about 40 to 45 mass. Okay, Miss Diaz, go ahead and take a deep breath in, blow it out, hold it out. Beep. So this next overhead is going to be the PA axial projection. So my patient is already or still in PA. So now I'm just going to angle my tube about 30 to 40 degrees. I'm just going to do 30. And the central ray is going to be at the mid-sagittal plane, and it's going to exit the as-is. So here's my crest, so the as-is is down this way. So I have to move my IR to match the angle of the tube. And I'm going to put my IRN 14/17 lengthwise. My SID is at 40, and the technique I would use is 90 to 100 kV and 45 mass. And I'm going to put my marker on the patient's left side in the light field. Okay, Miss Diaz, go ahead and take a deep breath in, blow it out, hold it out, beep. So this is my PA oblique LAO position. My patient is currently prone. So Miss Diaz, I'm going to have you roll up. I want the patient about 35 to 40 degrees. Okay, that's good. Yeah, just put your knee up a little. Okay, and then my central ray is going to be at the iliac crest and 1 to 2 inches medial. Let me feel for the crest. SID is at 40. Line. So now I have my IR lined up with the tube. It's at 14 by 17 lengthwise. And see, my patient is on the left side. So left side down. So I'm going to place my marker. Right here on the left side of the patient. And my technique I would use is going to be about 95 to 100 kV and 50 mass. So Miss Diaz, go ahead and take a deep breath in, blow it out, hold it out. Beep. Okay, so the next overhead we're going to shoot is the left lateral DQ. So Miss Diaz, can you scoot back? And then back against the iron. Okay. So I want my SID at 40. Make it work. Okay, my central ray is going to be at the iliac crest and the mid-sagittal plane. And this is my left lateral DQ, but I'm going to use my right marker. Put it at the top of the IR. My IR is 14 by 17 lengthwise. Okay. So Isabel, go ahead and take a deep breath in, blow it out, hold it out, beep. You can breathe. And my technique that I would use would be about 90 to 100 kV and 40 to 45 mass. Okay, so my patient is already in the lateral position. So now I'm going to do the left lateral rectum. So my SID is at 40. See, its central ray is going to be at mid-coronal plane. Can you scooch forward just a little bit? Okay, that's perfect. And then, so mid-coronal plane at the level of the as is. Okay. Okay, I have my IRN lengthwise 10 by 12. And then I'm going to place my left marker on the patient's left side down. So I'm going to place it right underneath the patient. And the technique I would use for this is about 90 to 100 kV and 90 mass. So Isabel, go ahead and take a deep breath in, blow it out, hold it out, beep. So now that I'm done with my overheads, Miss Diaz, I'm gonna deflate the tube from your rectum. And I have towels here for you. Okay, and I have my trash can right here to throw the bag and everything away. Everything goes in the trash can. We keep these. And there's the step stool, and the bathroom is right this way. So slowly roll over on your back. I have towels underneath you. And then take your time, and once you're ready, get up, and there's the bathroom, and you could go ahead and use the restroom and come back out, and we'll take one more image, a post-evac image. Okay, so now Ms. Diaz is back from the bathroom. She has evacuated barium, and we're going to shoot KUB. So my SID is going to be at 40 once again. We're going to center at the crest and mid-sagittal plane. I'm going to open up my collimation to 14 by 17, and I have my cassette in lengthwise, and I'm going to place my right marker on the patient's right side, and the technique I'm going to use is about 85 kV and 40 to 45 max. So go ahead and take a deep breath in and hold it in. Beep. And breathe. And now we're done with our images. So Miss Diaz, once you go home, be sure to drink lots of fluid. Your stool, there'll probably be coloration, might be white or a little grayish. That's normal. You want to hydrate and get as much of that contrast out as possible.
Okay.
Here is the right lateral decubitus. It's basically the opposite of the left lateral decubitus, and it shows the medial side of the ascending colon right here, the medial side, and it shows the lateral side of the descending colon up here. That is best demonstrated. So this is a PA oblique projection, RAO position. It opens up the right colic flexure right there. It also gives a good visual of the ascending colon as well as the sigmoid region. Here's the ascending colon, and here is the sigmoid region. This is the PA projection. It's done to visualize the entire colon filled with barium and air. We want to see both flexures. Here is the right flexure, here is the left, as well as the ascending colon, the transverse, and the descending colon. right here. Next, we have the PA axial projection. It's done to visualize the sigmoid region of the colon. Because of the 30 to 40 degree caudate angle, it appears elongated, and this helps to open it up and better visualize it. So here's the sigmoid, and it's elongated. This is a PA oblique projection. In the LAO position, it opens up the left colic flexure, which is right there. So here is my left lateral decubitus. It shows the lateral side of the ascending colon, and it also shows the medial side of the descending colon right here, because air rises with help of gravity. Here we have our image of the lateral rectum projection. It demonstrates the rectum area as well as distal sigmoid portion. Here is the post-evac. It's the last image after the patient has defecated as much barium as possible. There's many pathologies to be aware of when reading images. Here's an example of colitis, which is inflammation of the colon, and you could see that the contrast isn't very smooth. It has a rough cobblestone appearance.